Is the Biden administration funding the distribution of crack pipes and heroin for drug use? No, that's not true. The Department of Health and Human Services, HHS, is offering harm reduction program grants to organizations that provide harm reduction services. While a description of the grant stated that the grantees would be required to buy materials like safe smoking kits and supplies to enhance harm reduction efforts, such kits and supplies are just a few of the many materials that grantees can utilize. The content of such kits was not described in the grant description. The claim, which originated from an article published by the Washington Free Beacon, appeared in a similar iteration in an article, published by the Daily Caller on February 7, 2022, that was titled, "Biden Admin to Fund Crack Pipes, Heroin for Drug Addicts." The article opened, quote, "President Joe Biden's administration is planning to facilitate drug use with a policy agenda reminiscent of those deployed in some major blue cities like San Francisco." Biden's Department of Health and Human Services, HHS, closed grant applications Monday for a plan to fund the distribution of crack pipes to drug addicts, the Washington Free Beacon first reported Monday. Meanwhile, the Department of Justice, DOJ, told the Associated Press Friday it's open to allowing safe injection sites where drug addicts can use heroin and other dangerous drugs in an environment with protections against overdoses. The Crack Pipe Grant Program will distribute $30 million to local governments and nonprofits in an attempt to make drug use safer, and it will begin in May. HHS said it will provide smoking kits, supplies for addicts to reduce risks of infection when smoking with glass pipes. End quote. Users on social media saw this title, description and thumbnail, quote, "Biden admin to fund crack pipes, heroin for drug addicts." President Joe Biden's administration is planning to facilitate drug use with a policy agenda reminiscent of those deployed in some cities like San Francisco. End quote. Harm reduction encompasses strategies used to minimize the negative effects of substance use. Applications for the 2022 Harm Reduction Program grant closed on February 7, 2022, and the anticipated start date of the program is May 30, 2022. The grant description states that the funding's main purpose is to support harm reduction activities. It lists safe smoking kits, supplies, substance test kits, including test strips for fentanyl and other synthetic drugs, and syringes to prevent and control the spread of infectious diseases, as some of the potential materials that grantees can use for harm reduction. However, there is no mention of the content of safe smoking kits in the grant description. The article from the Washington Free Beacon claimed that an HHS spokesperson told the outlet, "These kits will provide pipes for users to smoke crack cocaine, crystal methamphetamine, and any illicit substance." However, the article later stated, quote, "An HHS spokesman declined to specify what is included in the smoking kits." Similar distribution efforts provide mouthpieces to prevent glass cuts, rubber bands to prevent burns, and filters to minimize the risk of disease. End quote. These claims seem to contradict one another. The Washington Free Beacon's reporting is also at odds with statements made on Twitter by Sarah Lovenheim, the Assistant Secretary for Public Affairs for the HHS, on February 8, 2022. In response to a video from Senator Marco Rubio of Florida in which he says the Biden administration would send crack pipes and meth pipes to underserved communities, Lovenheim tweeted, quote, "Blatant misinformation. The harm reduction grant is designed to help folks struggling with substance use stay healthy and safe, prevent overdose death. The grants must stick to federal, state, local laws or regs." End quote. Lovenheim then responded to backlash from Senator Tom Cotton of Arkansas, who also repeated the crack pipe distribution claim. Lovenheim tweeted, quote, "To be clear, HHS is not distributing crack pipes. The grants fund harm reduction efforts by organizations, in full adherence of state and local laws." End quote. In an email to Lead Stories on February 8, 2022, an HHS spokesperson said that the comments in the claim were misleading and misinformed. They went on, quote, "Evidence-based community harm reduction services such as naloxone, fentanyl test strips, and syringe services programs help people stay alive and are proven strategies for addressing this tragic epidemic."